At one look, it looks like a left bundle branch block. But wait before you jump to that conclusion. Pattern in leads 1 and AVL resemble that in LBBB. But V5 shows negative complexes, which is not typical of LBBB, violet arrow. There is left axis deviation as indicated by negative complexes in inferior leads, green arrows. PR interval can be seen as varying on scrutiny of multiple beats, but PP interval is constant, red arrows. Atrial rate is higher than the ventricular rate. PP interval shorter than RR interval. Hence, the four criteria for complete heart block are satisfied. Regular PP interval, regular RR interval, totally varying PR interval, atrial rate higher than ventricular rate. But there is a catch here. It should be an infrahisian block as the QRS is wide. We would expect the ventricular escape rate to be around 40 per minute. But here it is 60 per minute. This should make us suspect that it is right ventricular apical paced rhythm in a person with complete heart block. Then where is the pacing artifact? It is hard to locate any pacing artifact even on close scrutiny. Why? Look at the low pass filter setting. 40 Hz. Yellow arrow at the bottom of the ECG. Pacing spike or artifact is a high frequency signal which needs a low pass filter setting of 100 Hz for detection. Here, since the low pass filter is set at 40 Hz, pacing signals are not displayed in the ECG. This is a common problem with digital ECGs. If the person or caregivers are not mentioning the presence of a pacemaker when in an emergency department, it is easy to mistake the ECG for just left bundle branch block. Of course, a routine chest X-ray will very well show the pacemaker. Changing the low pass filter to 100 Hz or more will show the pacing artifacts well. An alternate option in most modern ECG machines and monitors is to switch on pacemaker detection, which will produce a very prominent pacing artifact in the tracing, often of very large amplitudes. What are these high pass and low pass filters? Here the high pass filter is at 0.5 Hz. It means that only signals above this frequency level will be detected. This filter is meant to filter out the baseline fluctuations due to respiratory thoracic movements, which is in the low frequency range. Low pass filter is meant to filter out high frequency signals, mostly electromyographic in origin, which is of high frequency. This is another ECG in which pacing spikes are not visible because the filter is set at 0.08 to 40 Hz. A repeat ECG taken with filter set at 0.08 to 150 Hz clearly shows both atrial and ventricular pacing spikes before each QRS complex, marked by red and blue markers in AVF. Hence, this person has functioning dual-chamber pacemaker in situ. The paced P waves are of low amplitude and hardly visible, or it could be lack of atrial response to atrial pacing, atrial capture failure. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video.